Hi, my name is Anola. I'm the nursing student at Ball State University. Today I'm going to be doing a little health history and a physical exam. It should take about 10 to 15 minutes, but I'll be here till 3 if you need anything. Can you tell me your name and date of birth?
Allison Williams, I'm 34.
Okay. Can you tell me what brings you in here today?
Yeah, so I basically just been having some fatigue and hand and wrist pain for the past 3 months, and that's in both hands. And it's starting to interfere with my sleeping schedule.
Okay. Is there anything that you take to help relieve the pain?
Yeah, I've been taking some NSAIDs, and they've been helping with minimal relief, but other than that, not really.
Okay. Is there anything that makes it worse? And if it does make it worse, what are the characteristics of it?
Yeah, so every morning I wake up, I have really stiff fingers, and it lasts for like 2 hours, and I've been having really itchy and burning eyes.
Okay. Do you have any history of rheumatoid arthritis in your family?
Yeah, I have a family history. My mom got it. She was diagnosed around 35.
Okay. Do you currently have any children right now?
Yeah, I have a 4-year-old and then a 5-month-old right now.
Okay. Do you plan on having any more?
Yeah, my husband and I want one more child, and we want to just complete the family.
Okay. Are you currently working right now?
Yeah, I'm a full-time employee with the local symphony orchestra, and I'm playing the first line chair flute.
Ooh, that sounds interesting. How's that going?
Honestly, I'm stressed right now. I've heard a lot of talk around my job that they're going to be cutting down the hours and that they're going to be doing some budget cuts.
That must be really stressful for you.
Yeah, my husband and I are currently coming up with the plan right now if that does occur.
Okay. Do you have a history of smoking?
Yeah, I smoke half a pack a day, and I've tried to stop 3 times, but it's been pretty unsuccessful for me.
Okay, well, what have you tried to do to help stop smoking?
Well, I've tried to chew gum. I've tried to distract myself with other things, but that's really it.
Okay, maybe I can talk with the doctor and we can get you something that has nicotine in it and just lower the nicotine level over time and see if that'll help.
Okay, sounds good.
I'm going to go ahead and do the physical exam on you.
Okay.
So I want to look at your hands and your wrists. Okay, and I'm going to have you stand up and touch your toes. I'm going to feel your spine. Okay, you can go ahead and sit back down. I'm going to get some labs and some scans drawn up, and then we'll go from there.
All right, sounds good.
Can you tell me your name?
Allison Williams,
What's today's date?
September 27, 2021.
And where are we?
We are at the health building.
What is your beliefs about hospitalization and diseases?
So I believe that the hospital has my best interest, so I am willing to do anything my doctors or nurses prescribe or tell me to do.
Okay. Do you have any educational background?
Yeah, I went to college and now I play for the orchestra.
Okay. Where do you live currently?
I live in the city with my husband and my daughters.
Okay. And then how do you feel about taking medications that are prescribed to you?
Like I said earlier, I will take anything that is affordable and that you guys prescribe just in my best interest.
Okay. And then how do you feel about herbal supplements?
I try to stay away from those for the most part unless recommended.
Okay. So the results of the rheumatologist's physical examination included warm, swollen, and painful proximal PCP and MCP joints bilaterally with slight limitations in range of motion. The cervical spine had stiffness as well. The bilateral bone scans of the hand and cervical spine shows early joint erosion. The laboratory findings include a positive rheumatoid factor, positive anti-CCP, and elevated erythrocyte sedimentation rate. Tell me about what health insurance plan you have.
Okay, so right now I have the individual insurance coverage from that's obtained through the Federal Exchange. I have the bronze level plan. The insurance company pays 60% of my healthcare expenses after a $5,000 deductible. For my out-of-pocket expenses, they're capped at $6,600. I pay 35% of my covered drug expenses. If some medications are not included in my drug insurance coverage, I'll be responsible for the full cost of it. Come in.
Hi, I just got back done talking with Dr. Robert. He has looked at all of your labs and your scans, and he has diagnosed you with rheumatoid arthritis, and he has prescribed the following medications: Prednisone, 10 milligrams by mouth daily; Methotrexate, 7.5 milligrams by mouth every week; Meloxicam, 15 milligrams by mouth daily; and folic acid, 0.5 milligrams by mouth daily. Would you like more information about the medication and your diagnosis?
Yes, please.
What do you know about rheumatoid arthritis right now?
I just know it affects your joints. Other than that, that's all I really know so far.
Okay. Are you ready to start taking your medications daily?
Yeah.
What environment do you learn best in?
A calm one where I'm able to listen to who's talking and there's no other distractions around.
What do you think is important to learn first, your medication or your diagnosis?
I think the medication, so I'm able to get on task with that first.
Okay. And then what are some goals you have with rheumatoid arthritis in the future?
I want to be able to continue to play the flute, to be able to do things at home and take care of my family and enjoy daily activities.
So the first med we're going to talk about is the Prednisone, 10 milligrams by mouth daily. This med is used for bridging medication, so waiting for the correct med for RA to start working, or for acute exacerbations, which is what Miss Williams has right now. It works by blocking the production of interleukin-1. It is also a potent anti-inflammatory agent. You can take this by local injections to your RA joints or by mouth. Dosing is highly individualized, and you want to start low and slow. Some side effects of prednisone are weakness, fainting, anorexia, nausea, vomiting, hypotension, shock, headache, insomnia, or seizures. You want to make sure you take this medication before 9 a.m. every morning to mimic the early morning glucocorticoid burst. When you're done taking prednisone, you want to taper off your medication to decrease you'll know when to start tapering off your medication when you start seeing decrease in your CSR, your pain, and your ANA and inflammation. The next med we're going to be talking about is methotrexate, which you're prescribed 7.5 milligrams by mouth every week. This med is primarily used for cancer. It suppresses the B and T lymphocytes. It takes 3 to 6 weeks to have the full therapeutic effect. So you want a bridged gap medication included, which is your prednisone. Some things you need to monitor while taking this medication is your BNP, your CBC, and your liver function, which includes your AST and your ALT. You want to take it by mouth with food to protect your GI stomach lining. It's given once a week and it's excreted in your urine, so you definitely want to watch the liver functions. It's contraindicated in pregnancies, so we need to make sure that you are not getting pregnant right now and that you are using contraceptives, because this can cause birth defects. This is also a bone marrow suppression medication. You want to start with lower doses with autoimmune diseases. This also depletes your folic acid, so you'll need a supplement. You want to watch your BUN and creatinine and CBC. You need to reduce the dose if your bilirubin is between 3 to 5 milligrams per deciliter, or your AST is greater than 180 units per liter. You want to hold the med and notify your doctor if your bilirubin is above 5 milligrams per deciliter. The next medication is the folic acid, 0.5 milligrams by mouth daily. You need to take folic acid because methotrexate depletes the folic acid. Folic acid creates red blood cells, and since you have a depletion of it, you're going to need that supplement folic acid to maintain your baseline. The last medication is the Meloxicam, 15 milligrams by mouth daily. Meloxicam works by inhibiting the COX-1 and COX-2 pathways. It's used to treat inflammatory disorders. It alleviates mild to moderate pain and suppresses fever. When taking Meloxicam, you need to be cautious of the black box warning, which is increased risk for GI bleeding and cardiovascular events. When taking Meloxicam, you need to monitor your CBC, BUN, and creatinine. When taking this NSAID, you also need to take a PPI, which will protect your stomach lining because NSAIDs break down your stomach lining. You take this med by mouth. Some side effects of NSAIDs are dry mouth, gingival hyperplasia, dyspepsia, heartburn, nausea, epigastric pain, constipation, bleeding, GI ulceration with occult blood loss, nephrotoxicity, which means it's hard on the kidneys. And this drug does not have any protection against MI or stroke. Remember to take this with food. Report any signs of bleeding.
Okay, so basically rheumatoid arthritis is a chronic and systemic autoimmune disease. There are periods of remission and exacerbation. It's basically an inflammation of the connective tissue in your synovial joints. The origin is unknown, but there are some factors that contribute to it, such as pollution and smoking, as well as illnesses that are both viral and bacterial. There is a genetic link shown. A lot of times it's family history with the first degree relative. It affects ages 30 to 60, and females are more likely to be affected. Rheumatoid arthritis is an autoimmune reaction in your synovial joints. Like I said earlier, your immune system attacks your synovial tissue and results in inflammation and destruction in your synovial fluid, and it usually starts in the more distal areas, such as like your fingers and your wrist, and then it works its way in. You do not want to delay treatment because it can cause unfixable damage. You're also going to need a lifelong medication because there is no cure. Some clinical manifestations are symmetrical and bilateral joint pain with always having inflammation. You're going to have joint swelling and stiffness after inactivity, such as in the morning at least an hour after sleep. You're going to have warmth and redness. You're going to have limited range of motion. You're going to have some deformities in your hands and feet that are common, such as ulnar deviation, swan neck deformity. And so you need to make sure that your skin is not breaking down and that you can still participate in fine motor skills. And it's wise to collaborate with occupational therapy. Rheumatoid arthritis has an acute onset, and it's usually after periods of stress. Some other side effects of rheumatoid arthritis could be fever, weight loss, because you aren't hungry, you're just feeling fatigued. You're going to have anemia. You can have lymph node enlargement, Raynaud's phenomenon, which is not specific to RA, but it's whenever there's extreme cold or stress, it causes vasospasm and you have blue or colorless fingers. 40% of people with RA die from a cardiovascular issue, so that's very important to watch and monitor on the labs. Neuropathy, and that's going to be inflammation over the nerves. Felty Syndrome is when you have rheumatoid arthritis, splenomegaly, and you have a decreased white blood cell count. Sjögren's syndrome is dry mouth and dry eyes. And then you can have rheumatoid nodules, which 20% of patients have this, and it's just movable masses in your sub-Q. Some diagnostics are the RF, or rheumatoid factor, which is not specific to RA, and 70 to 80% have this. The most specific one is the anti-CP, and it's 95% detection. Some others are your platelet counts, your CRP, and your ESR to tell you if there's an active inflammation, but not exactly where it is. You can also look at the CBC to see if there's infection. You can look at the skin test. You can look at BUN and creatinine, ALT, AST, and you need to know how the meds are eliminated, which we talked about earlier. Another way of diagnosing RA is by a point system. In the point system, if you're over 6, then you are diagnosed with RA. It includes 3 factors. It includes the number of joints affected, your labs, and then if it's lasted for over 6 weeks. As far as imaging studies for supportive data, you can do an x-ray of your hand, wrist, or feet. You can also do an ultrasound, a CT scan, an MRI, or an arthrography or arthrocentesis. And that's basically where you aspirate synovial fluid, and usually it's cloudy, milky, with some dark yellow synovial fluid.
Some nursing diagnosis includes acute and chronic pain, which can be alleviated by providing comfort measures like heat and cold, position changes, relaxation techniques, or administering anti-inflammatory analgesics. Another nursing diagnosis is fatigue. So you need to help the patient develop a sleep routine, schedule your balance and the rest and your activity, so you need to balance it equally. And you want to encourage adequate nutrition. And most people that have RA can develop anemia. So part of anemia causes fatigue, so maybe an iron supplement could help that as well. Another nursing diagnosis is impaired physical mobility. So you want to collaborate with a PT or OT, and you might have braces, splints, and assisted devices to help your everyday life. You want to encourage independence and mobility, and make sure they have exercise and drink plenty of water. Another nursing diagnosis is self-care deficit. So you want to make sure you're assisting in identifying what self-care deficit they have, provide assistive devices to help them become independent, and consult with community agents.
Some other nursing diagnosis is disturbed body image, so you need to encourage verbalization of feelings and refer them to counseling possibly. Ineffective coping, so you need to identify factors that they're struggling to cope with and get a support system or support group. And we also have complications secondary to effects of medications, so you need to get periodic clinical assessments and lab evaluations. You need to provide education in how to correctly self-administer if they have a sub-Q. Some potential side effects, which we talked about earlier, and the importance of monitoring what and when to report signs. And lastly, you need to counsel regarding methods to reduce side effects and manage symptoms. So I was wondering if surgery is a good option for me since I am a flute player. I was wondering if that would help make things accelerate the process of getting better.
Okay. Usually we do not encourage surgery if your joints are not deteriorating. It is not good to do surgeries during exacerbation periods, which is what you're currently in since you just had a recent flare-up. But there are 3 options of surgery. One is synovectomy, tenopathy, and arthrodesis. We can look at those at later times when you're not in an exacerbation period.
Okay.
So after everything we've talked about today, do you have any more questions?
Yeah, so I'm a little concerned about cost because it is a new diagnosis and I am put on a lot of medications, just had a child, and like I said with work, I'm not sure how that's going to go down with the cuts and everything, so I just need help figuring out how I'm going to be able to afford this and all the doctor's visits I'm going to have.
Okay, so if a medication you cannot get covered by your insurance and you cannot pay out of pocket, just call us and let us know, and I can talk with your doctor and see if we can get you switched to a different medication that doesn't cost as much. As far as health visits and things like that, I can get you in contact with a social worker, and she can follow you along and just stay by your side and help make sure everything is affordable financially to you.
Okay, sounds good. Thank you.
Thank you.
Come in.
Hi, I just brought you a handout of RA and about what it is and what information that you would need.
All right, thank you.
You're welcome. Out of everything we've talked about today, what are some things that you have learned?
So I have learned to balance my rest and activity, to meet with OT and PT if it progresses. I'm going to exercise in the water when I can because that's easy on the joints. I'm going to meet with the counselor to work on my own psychological issues with this new diagnosis, and I'm going to meet with social services for financial support, and then I'll keep up with my meds and visitations to make sure all my labs are in range.
Seems like you learned a lot.
Yeah, thank you.
All right, thanks for watching.